We are continuing the endocrine system chapter, talking about the adrenal glands now. Alright, so the adrenal glands are located on top of each of the kidneys. So we have two adrenal glands in the body. They're also sometimes called the suprarenal glands. Renal refers to the kidneys. So adrenal or suprarenal glands. This is neuroendocrine tissue, so both nervous tissue and endocrine system tissue. So they're influenced by both of those systems and work together really, really closely. These have some of the highest rates of blood flow in the body. Lots and lots of blood flow coming through here because these are really, really important hormones that we're creating in the adrenal gland. So we have an outer cortex of glandular tissue. So out here, that cortex, and then further inside is the medulla, which is going to be neuroendocrine tissue. So we've got some nerve cells in there. It's an extension of the autonomic nervous system, which we'll talk more about later in the semester. So the cortex of the adrenal gland is part of what's called the hypothalamic pituitary adrenal axis, or HPA axis. This is going to secrete steroid hormones that are really important for regulation of long-term stress response. They're going to help regulate blood pressure and blood volume. They're also going to impact how we are taking up nutrients and how we're storing those nutrients, as well as balancing fluids and electrolytes in the body, and even inflammation. So there is a lot at play here with that HPA axis. It is going to stimulate the adrenocorticotropic hormone, or ACTH, from that pituitary, which is going to stimulate the adrenal cortex to produce the hormone cortisol, which is an important part of our stress response. We'll talk more about that in a second. The medulla of the adrenal gland, again, is a combination of nervous tissue and endocrine tissue. So this is an important part of the autonomic nervous system, or the automatic nervous system. So these are automatic responses that we are not having to consciously think about. So this is going to have some stimulation of that medulla by impulses from the hypothalamus via neurons that come from the spinal cord. And so that hypothalamus, again, is showing its role in the nervous system and endocrine system, so a direct connection to this medulla of the adrenal glands. And it's going to stimulate that medulla to secrete protein-based hormones, which are epinephrine and norepinephrine. So, like I mentioned earlier, adrenal gland is really important for our stress response. This can be either physical or psychological, or a combination of both of those. So physical stresses would be injuries, walking outside in like cold and wet conditions without a coat on, and malnutrition, among many other things. Psychological stresses are obviously going to be either a real or perceived physical threat, a fight with a loved one, or even just having a bad day sometimes is seen as a psychological stress. And then obviously there are plenty of situations where both of those things are going to be at play. So we have some different ways of responding to short-term and long-term stress, following a pattern that is called the General Adaptation Syndrome, or GAS. So that starts with the alarm reaction. This is going to be a very short-term stress response. This is the fight or flight response. You are in danger in some way, shape, or form, or feel like you're in danger in some way, shape, or form. This is going to be mediated by epinephrine and norepinephrine coming from the medulla of the adrenal gland. Their job, the epinephrine and norepinephrine, their job is to prepare the body for some really extreme physical exertion. And so that fight or flight response is named fight or flight because we are preparing for extreme physical exertion. You are either going to be running for your life, or you are going to be fighting for your life. At least that's the basis. Things have changed dramatically for humans over a very, very short period of time as far as evolution goes. And so now we are dealing with a lot more of those psychological stresses causing this particular reaction. And if you look into some psychology, there's another version of this, which is the fight, flight, or freeze or fawn response, because freezing and fawning are two additional responses that are frequently going to come from very psychologically based stressors. Not entirely, but very, very frequently. And so that epinephrine and norepinephrine short-term stress response coming from the medulla, and once that stress is relieved, then the body is going to very, very quickly return to normal. So we're going to stop producing those hormones pretty quickly after that stressor is eliminated in whatever way, shape, or form, and then the body will return back to normal. If that stress does not get relieved quickly, the body is going to adapt to that into a second stage of this general adaptation syndrome called the stage of resistance. So this can be something like starvation, that malnutrition that I mentioned earlier. The body can also send signals to the GI tract to maximize absorption of nutrients from food. So we're not getting a lot of nutrients, take everything you possibly can from that food that you're eating. And then if the stress continues for longer than that, we're going to have our last of the three stages of that response, which is the stage of exhaustion. This can lead to individuals suffering depression or depression-like symptoms, immune system suppression, so our immune system's not functioning as well, severe fatigue, in severe cases, fatal heart attacks can happen. These symptoms are going to be more controlled by hormones from the adrenal cortex, like cortisol, released from that HPA axis. But adrenal hormones do have a lot of non-stress related functions, like helping to increase blood sodium and blood glucose levels. I'll talk more about those in a second. So that adrenal cortex, let's look a little bit more in detail there. So we can see here in this image, this is a histology slide. So we're looking at real adrenal gland tissue that has been stained. All right, so we've got some different layers of that cortex, as you can see here, the glomerulosa, fasciolatica, and reticularis, and then that adrenal medulla, very, very deep down internal. And so we've got some different hormones coming from each of these zones of the adrenal cortex. These hormones that are coming from the glomerulosa region are collectively referred to as mineralocorticoids. So their job is to regulate the balance of different minerals in the body, like sodium and potassium and calcium. And so an example of this would be aldosterone. Aldosterone is really, really important for regulating sodium and potassium ions in urine, sweat, and saliva. And so sodium and potassium are going to be really important for nervous system signaling, muscle contractions, and water balance in the body. So those are super, super important for water balance, and therefore blood pressure. So water balance and blood pressure are very, very, very closely connected. And so this aldosterone is going to help get rid of too much potassium and also help save or retain sodium. And then it can also do the opposites depending on what the body is needing. Aldosterone is a really important part of something called the renin-angiotensin-aldosterone system, or RAS system, in specialized cells of the kidneys. We'll talk a little bit more about that system when we do the urinary system a little bit later in the semester. We'll go into a bit more detail there, but this is a super important system that is going to help maintain blood pressure, blood volume, keep that water balance, which is also tied closely into sodium and potassium levels. The next zone, we have glucocorticoids. These are going to regulate glucose metabolism, so helping with making sure that we are having proper blood glucose levels. This is going to be cortisol, corticosterone, and cortisone. So those are three hormones given as examples here. Cortisol is probably the most important. The liver is going to convert some of this to cortisone. Cortisol is part of our long-term stress response again. And so what happens with those long-term stress responses is the hypothalamus is going to secrete this cortisol releasing hormone, which is going to release adrenocorticotropic hormone, and that is going to release all of these other glucocorticoids. And so the overall effect here of these is to stop building tissues. So we're not building our tissues and maintaining them and stuff like that. Well, it's also causing more breakdown of stored nutrients so that we have adequate fuel supplies to deal with those long-term chronic stressors. So cortisol can promote breaking down glycogen to glucose, so we're destroying our stores of that glycogen, which is our storage system for sugars. It can break down triglycerides, which are a great energy source, into those fatty acids, and it can also break down muscle proteins into amino acids, so long enough stress responses can cause the breakdown of muscle tissue, so that we have those basic building blocks for the body to use. So really, really, really important responses there with that cortisol. The cortisone might sound somewhat familiar, so there are some injections that can be done, so cortisone injections into very inflamed joints. Prednisone is a very commonly prescribed steroid medication that helps reduce inflammation. There's steroid-based inhalers for managing asthma, hydrocortisone creams for itchy skin. These are yet another role of these cortisol or glucocorticoid hormones, is kind of down-regulating or inhibiting the immune system response, and that is used to our advantage sometimes to help with that inflammation response. And then our last zone here, the reticularis zone, we're producing androgens. These are going to stimulate something called masculinization, which is giving somebody more what are traditionally considered masculine features, so deeper voices and stuff like that. And so these are only going to be in very, very small quantities coming out of the adrenal glands. Most of those androgen hormones are going to be produced by the gonads, the ovaries and testes, not the adrenal gland, but it does make enough of it to be considered as part of that particular system. So those androgens are going to get produced and are being signaled by adrenocorticotropic hormone. They get converted in the tissues to testosterone or estrogens. So after menopause, for people with ovaries, as the ovary function starts to decline and we decrease production of estrogen and progesterones, the main source of those estrogens comes from this particular source, and because it's in such small quantities, there can be a lot of symptoms associated with that. All right, and then the adrenal medulla, again, is that short-term stress response. So we have that happening, that epinephrine and norepinephrine, and so we are getting that stimulated to produce those by the automatic or autonomic nervous system right there. Again, we'll talk more about the nervous system much later in the semester. That's our last topic that we'll talk about, is the nervous system. So epinephrine and norepinephrine are neurotransmitters, and so these are also sometimes called adrenaline and noradrenaline. Those are alternative names for these two chemicals. We produce a lot more epinephrine. This is about a 4-to-1 ratio. It's a much more powerful hormone, and so it is going to increase heart rate and blood pressure and all that kind of stuff. And again, it's helping to prepare us to fight or flight. So fighting or running away in an attempt to get us out of that situation and get us back into a safe situation. This can also help increase blood glucose levels and a bunch of other things, but we are preparing to try to save our life. There are some disorders of the adrenal glands. We'll just look at this summary table of the hormones of the adrenal glands, but some disorders can happen. They're not particularly common, but they're not totally unheard of either. So there are some dysregulation of those hormones. Cushing's disease is one. This symptoms are going to be very, very high blood glucose levels and a lot of accumulation of fat deposits, lipid deposits in the face and neck because we are secreting too much cortisol. Most common cause of Cushing's disease is actually a pituitary tumor that's going to basically cause too much of that cortisol or ACTH secretion. Other causes can include some other damage to like the adrenal glands and stuff like that, which are going to mess up that regulation of cortisol production. Other symptoms can be a very, very round face and actually a hump on the back of the neck, extremely rapid weight gain, a lot of hair loss, stuff like that. So not a great situation to be in there, can compromise immunity, memory, stuff like that. So really, really not a good disease to have. The opposite of that is Addison's disease. This is pretty rare, so pretty uncommon to have Addison's disease. This can cause very, very low blood glucose levels and low blood sodium levels. Symptoms of this can be very, very vague and are similar to other disorders as well, so it can take a really long time to diagnose this condition. But this is, again, hyposecretion of these corticosteroids, so we're not getting enough of these hormones being produced. So this is going to be general weakness of the body, a lot of abdominal pain, excessive weight loss, a lot of nausea, vomiting, sweating, and massive craving for salty food because we're not having proper blood sodium levels. That wraps up the adrenal glands, and in our next video we will talk about the pineal gland.